to talk a little bit about the food stamp program. I want to talk about it because it is proposed in the Farm Bill that we'll be talking about soon, that there'll be a $20 billion cut from the program. Now, I just thought that I would come before the House today, Mr. Speaker, to talk about the realistic implications for regular people, and maybe even to try to stand against some of the misconceptions that people may have about the food stamp program. Last Monday, I was in my district and nearby there in St. Paul, and myself and Betty McCollum sat down with a number of our neighbors and friends and colleagues to talk about the food stamp program. And we had three groups of people who were talking to us. One was a group of people who are using the food stamp program. One of them was a senior citizen, and she was working. She was in her early 60s, got sick, couldn't work anymore, and was hoping to get to the age where she could retire, and get her Social Security, get other benefits, but she wasn't quite there yet. She got sick before she did, and she needed the food stamp program. Now, personally, as a taxpaying American, I got no problem helping this wonderful lady meet her food needs. Another was a young mom. Actually, she didn't have any money for child care, so she brought her baby to the meeting, who was across her shoulder in a sort of a wrap. And this young mom explained how she tried to get the best options for her baby, wanted to get back to work, but while she was in the middle of trying to find work, needed to have good nutrition for her child. We also talked with a person who was a young adult, 19-year-old guy, didn't get any food stamps until he passed out one day because he hadn't been eating. And then we talked to a person who was not a food stamp recipient, but who was a health care professional in Hennepin County. She explained that the food stamp program was essential for good health because she had a number of people. She talked about one woman in particular named Mary, who was complaining that was not taking her medication. Her doctor said, "Mary, you're not compliant on your medication." Well, Mary said, "Well, it hurts my stomach." And then so when the doc talked to her more, we found out she wasn't eating, so the medication was sitting on her empty stomach. When she got some food in her stomach, she was able to take her medication and be in compliance and stay well so that she could stay out of the emergency room. So, I mean, we talk with these folks, then we talk with people from the faith community, Jewish community, Christian community, and Catholic community, and all of them said that, look, you know, we do a lot of food aid. We're trying to make sure that folks have enough to eat, but if the government steps away from nutrition assistance, then that's just going to leave a bigger hole for us. They talked about how their food shelves were already being used a lot and how they already were struggling to meet the needs of the folks who came to them. So at the end of the day, they said, look, you know, we're not going to be able to step in where the government steps out. And so at the end of the conversation, it was clear to me that aside from statistics, aside from all the numbers, there is a human face on the food stamp program, and the cuts that have been proposed will be devastating. You know, let me just tell you this, Mr. Speaker. You know, if there was a program which said that it would improve children's math and reading scores, it would prevent diabetes, asthma, and depression, it would contribute to healthy babies with fewer developmental problems, it would decrease health care costs and lower the poverty rate, would you support it? That's the food stamp program. It needs to be supported. And I thank you and yield back the balance of my time.
Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until noon today.
The U.S. House today continues work on the 2014 Defense Authorization Act, a bill that includes $552 billion in spending for national defense and an additional $86 billion for the wars in Afghanistan and other overseas operations. When members return this afternoon, they'll begin work on over 170 amendments that have been filed to the bill. Some of the issues include the treatment of detainees at Guantanamo, sexual assaults in the military, NSA data collection, and the war in Afghanistan. Several rounds of votes are expected this afternoon. We'll have live coverage here on C-SPAN. Meanwhile, the Senate continues work on a bipartisan immigration bill which creates a path to citizenship for most of the 11 million undocumented immigrants and also tightens security along the nation's southwest border. They had an amendment vote earlier, defeating an amendment by Charles Grassley of Iowa. Watch the Senate on C-SPAN 2 and the House here on C-SPAN.
The C-SPAN video library has reached a milestone since it's on